I'm Sally O'Driscoll with Resisting Project 2025. Today in our interview series, we're focusing on the Republican cuts to Medicaid. The Trump administration has already been busily engaged in dismantling the network of social services that support people with disabilities, partly by firing the federal workers who keep the programs running. We reported on Project 2025's plans for those cuts before the election and followed up with an April Substack to discuss how far the plans have already been implemented. And you can find those reports on our website, resistingproject2025.org. Now it's time for another look. As it happens, we're conducting this interview just a few minutes after the Senate passed the quote-unquote big, beautiful bill that will strip $1.1 trillion from Medicaid, Medicare, and Obamacare, with more than $1 trillion of those dollars are the cuts coming from Medicaid alone. So it has been estimated that the Medicaid cuts could result in more than 16,000 preventable deaths annually, and would also result in at least 7.6 million people losing health coverage. Other sources have estimated an even higher number of people who will lose health insurance, 11.8 million over the next 10 years. One of the main provisions of this bill is to establish a new strict national work requirement for some people on the program who would need to demonstrate that they had worked at least 80 hours the month before they sign up or qualified for an exemption. The Senate version applies this provision to the poor parents of children older than 14. In addition to childless adults without disabilities, the group targeted by the House version. A second provision will restrict the ways states can leverage federal aid to increase their Medicaid budget, and this would mean that many rural hospitals could close despite a new $25 billion fund to support them. And that, of course, would make it much harder for people in rural areas to receive care. But those numbers are so huge that they are difficult to understand. And in order to break this down, we're talking to Susan Walter, a specialist in financial planning for families where one member has a disability. She's going to give us a nuts and bolts explanation of how exactly the cuts will affect real families in ways that the bill doesn't acknowledge. Susan Walter is a financial planner with a specialty certification as a chartered special needs consultant. She regularly conducts seminars on special care planning topics, and she provides holistic financial planning for families with a disability. Her focus incorporates financial and retirement planning for the family, as well as securing the safety and well-being for the individual with the disability. This can include considerations in the areas of education, trusts and trustees, maximization of government benefits, and health and wellness, to name just a few. Her professional background includes work in the corporate and not-for-profit sectors, plus positions as an adjunct professor with several colleges. And her personal background includes volunteer activism with her local epilepsy foundation. When her own youngest adult child developed an impactful disability, she learned firsthand about the complexities of disability planning. So welcome, Susan, and thanks for talking to us. Before we get into the details of how the cuts will affect those who depend on Medicaid, let's start with the question of who gets to access benefits. In other words, when we talk about Medicaid, who exactly are we talking about?
Oh, hi, Sally. Thank you so much for having me. This is a topic that's near and dear to my heart, so I'm ready to dig in. So Medicaid is just often talked about, it's the welfare, right? So doctors, hospitals, clinics, nursing homes, but Medicaid covers so much more. So over 80% of those on Medicaid are seniors and adults with disabilities, which is kind of interesting because aren't we often told a line that there are lazy people sitting playing video games or some such thing, right? And it's just couldn't be, it's just not the case. Medicaid is means tested, right? So we're talking about people who are resource deficient, cannot be competitively employed. And so we're talking mostly about seniors and adults with disabilities. So much of the conversation is obviously about doctors, access to doctors and specialists and caregivers, hospitals and nursing homes. And that's just not the case. Medicaid covers so much more. So what are we talking about? What don't we hear about? Medicaid is delivered in states, and it's done at the state level or the county level. So state to state, Medicare programs change completely. And it's not even always called Medicaid. Some folks don't even know they're on Medicaid because they have different names. So in Pennsylvania, where I live, it's called medical assistance. In Wisconsin, it's called Badger Care. So in some places, it is still called Medicaid, but people don't necessarily even know that they're utilizing a Medicaid service. So what else does it cover? Department of Human Services or community-based services or home and community-based services. They can have lots of slightly different titles, but we're talking about in-home caregiving. We're talking about transportation. We're talking about case management and coordination, maybe job coaches, some aspects of housing, SNAP nutritional assistance program, and there's more. So it's just it's large, and I think we just don't necessarily always talk about all of the other things that are covered under Medicaid.
Yeah. So who else, apart from those directly who receive those benefits, who else is down the line from there? Who else is going to be affected by these cuts?
Right. So if you think about the fact that I mentioned case management, think about the direct caregivers for the people who are receiving the care, right? Think about the case management or the social service agency that employs and hires those people. The latest statistic I saw was that there are about 2.6 million people employed in the human services sector. That's a lot of people. Those are a lot of jobs. So when Andy Beshear, governor of Kentucky, recently mentioned, just this week in one of his speeches, he mentioned thousands of employees who might lose their jobs, and he was only really talking about the healthcare delivery, not all these other aspects of Medicaid delivery, community
So,
services, supports, and those sorts of things. Yeah.
so we're talking about a loss of employment for people who are working within Medicaid to deliver those services, and they are also going to be profoundly affected.
Correct. That's right.
Okay, so let's just talk more about, you mentioned before that the states deliver Medicaid in many cases.
Mhm.
So as the bill that just passed the Senate shifts responsibility for most of those services to the states away from the federal government, so then what happens when federal dollars are removed from state budgets for Medicaid?
Right. So let me address two things. Number one, the cuts aren't scheduled according to the current way the bill is drafted. What I've read is that nothing is meant to take effect until after the midterms. So you're not necessarily going to see the cuts in action until a little bit later down the line. This lets people hide behind it a little bit. At the state level, states have two really big expenditures that capture a substantial portion of their budgets. Often, first is education, and second is human services, and this is Medicaid. So it's one of the largest budget items. And then there are smaller things like public welfare housing or transportation and corrections and those other kinds of state budget issues. But the two huge ones, education's often first, and then Medicaid spending. So the question is, if the states are going to be more responsible for Medicaid, what's going to get cut if they can't fund it? And the difference is what's mandatory. So things like healthcare delivery, that's mandatory. Hospitals, mandatory spending. What's optional? Waiver programs. Waiver programs are what's optional.
So it's the state who is now going to decide which optional aspects of Medicaid, which services are going to be kept and which are going to be ditched.
Right. So if you have to cut money, what goes first, mandatory or optional? So optional is going to be on the chopping block first. And so people often ask, like, well, what is a waiver? There was a time when I didn't quite understand what waivers were. So we have to look back in history when people with disabilities or people who didn't have anyone to care for them, they may have been institutionalized, right? And then institutions, they had their own difficulties. It may have been abuse or overpopulation or a variety of issues where states came down and said, no more institutions. We would like to have people back into their homes. So you got a waiver to not be supported by an institution. It allows people back into their homes and to be supported back in their homes. Does that make sense? So a waiver program can be a variety of in-home services, community service, adult daycare services. It can also be direct dollars, someone with a disability getting some housing assistance. State to state, different. There are thousands and thousands of different kinds of waivers. So Medicaid does not move state to state. It's not portable. Each state does their own Medicaid. If someone moves from a different state, they start all over. They have new things to discover, new waiver programs. So Medicaid is delivered state to state, as well as the waiver programs that they choose to, and that allows for some customization for what's necessary in their area.
Mhm. Um, so how do people qualify to get these waivers to
Waivers,
give them
right,
services that they need?
right. So the gatekeeper is Medicaid. So if you don't qualify for Medicaid, it's near impossible to qualify and get a waiver, right? So these are often run either at the county level, so there's the state, there's the county level, and maybe a township. So it depends on the size of the state and how they organize their Medicaid programs. But you qualify through Medicaid. By the way, I just want to point this out. I've lived in multiple states. I have an adult child with a disability. So I've applied for waiver programs. He qualifies for Medicaid because of his disability. And when we lived in the state of Kentucky, we had lived there for maybe a month or two, and it was time to um, develop a relationship with our case manager and apply for waiver services. So Henry was waitlisted. Just because you qualify for a waiver doesn't necessarily mean you're going to get a waiver. Wait lists are long, years long, thousands of people ahead of you long. We lived there for about 5 years. He was still on the wait list.
I mean, so what you're saying is that although on paper it looks as though Medicaid waiver services are being delivered, they may in fact not be being delivered because there's a lack of staff, a lack of money, a lack of providers, all of that. And so kind of being eligible for Medicaid doesn't necessarily mean anything in your real life.
That's correct. It can be years and years and years.
Mm.
I know of a young man who has a part-time job. He has severe epilepsy. It impacts his ability to be competitively employed. It affects his ability to show up for work sometimes. And so he has a nice employer, but he still lives at home because he cannot live independently due to his epilepsy. And so he's on a wait list. So he qualifies for Medicaid, he qualifies for the waiver. He's been on a wait list now for 5 years to assist with appropriate housing. So his parents are approaching their 80s. It can be kind of a tough time for families, right? The wait, the unknowing, the not knowing, the difficulty in getting services lined up.
And being too old to care for an adult child at a certain point and not be given any help in
That's
dealing
right.
with that situation.
That's right.
Now, you consult with many families. trying to get them the benefits that they are entitled to. Can you give us some, obviously, keeping them anonymous and changing details so that that's the case, but could you give us some examples of things that you've seen, the kinds of people you're trying to help, and how, whether you're able to give that help?
Oh, sure. So I'm changing names just to protect everyone's privacy. I have Kay. She's a single mom. She has a toddler. There's an undependable dad. He decided he didn't want to be a dad. He left. She works full time as an in-home care provider for a human services agency. So she's one of these employees throughout the whole structured system. She's in nursing school full time. She receives Medicaid for herself and her toddler. She receives subsidized housing as long as she is in school full time. She receives SNAP, SNAP, SNAP benefits. We used to call them food stamps, Supplemental Nutrition Assistance Program. She puzzles her childcare between a paid provider, someone in the neighborhood, and maybe some family members who are nearby when things fall apart, people get sick, whatever. If if she loses her job, she won't be able to go to school full time. She won't qualify for subsidized housing. And it's just this cascade effect. But she would be one of the first frontline caregivers, right, to possibly lose her job. And someone who's working full time, school full time, taking care of a toddler, being responsible for herself, trying not to be a burden on anyone. There's nothing lazy about that or whatever these other stories are told. Here's someone who's trying to make a living for herself and her family. Or how about this one? Jay is a 30-year-old with cerebral palsy. He has mobility with a motorized wheelchair. He works part-time. There's no intellectual disability, lives with a sibling who has a great job that provides housing and excellent accommodations for his disability. He requires in-home care, whether it's the sibling or during the day when she's working, um, in-home caregiving to change catheters, help him with dressing, bathing, mobility from wheelchair to toilet or wheelchair to bed, right? He can eat by himself, but he can't prepare his food by himself. He can access transportation in the neighborhood on his own. So what are the risks? The dependability of caregivers coming into the home. The sibling has a job, has work, and needs assistance with his day-to-day care. Future housing. What if something happens to the sibling? Where is he going to go live? And a waiver program would be taking care of those two things: housing, accessibility, and caregivers.
Right, so we're talking about extreme effects on people who are already
Mhm.
working as hard as they can to hold things together with very little support from the social safety network.
Yeah, correct. That's right. How about B, a 40-year-old with an intellectual and developmental disability uses the waiver programs for community-based assistance. This includes housing, therapies, caregiving, some transportation. This individual can quasi live independently as long as there is frequent checks. So like overnight sleeping, someone needs to come in and kind of check that the beds are made. This individual cannot make the bed or wash hair, but can prepare a small meal. So you see how specific all of these different situations are, right? It's no one size fits all. Um, cannot handle finances and is so friendly, also vulnerable, right? In kind of the outside world to someone taking advantage. The parents are aging and the siblings are in the throes of their kind of like early family years, working really hard. So, what if some of these supports disappear? She qualifies for Medicaid. She receives waiver services. home and community-based services, right? If these disappear, does she move back into her aging parents' home? It's like it's disrupting the planning that people have been working to put in place because all of a sudden the rules are switching it up and changing. It's anxiety making at the moment. And just like a real sandwich generation story. Here's M, a woman in her 40s, right, with a children, a spouse, they're in a dual income family. Most people still need two people working now. Her mother has a progressive dementia and requires supervision. The mother's moving into their family home. Um, M is using an adult daycare program so that she herself can still go to work. What if that adult daycare program disappears? So those are just some like examples of how waiver services improve life, allow everyone to sort of live to their best potential. I'm really concerned. So the unknowns are still too difficult to make any, no, I can't look in that crystal ball and understand exactly, but knowing that optional programs like waiver services, the home and community-based supports are probably the first on the chopping block is really, really, it's not only discouraging, but it's kind of scary.
Well, one last question about the way that Medicaid is being delivered. Have the employee cuts at the Department of Health and Human Services, have they affected already the way that Medicaid is being offered, or can you get the information you need from the department?
So often Medicaid kind of starts with Social Security. So with the disruptions and upheaval at Social Security, sometimes it was closing an office, reopening an office, staffing at an office. Some people are on hold to even just apply for Medicaid or some of the other aspects of government benefit programs. I've been on hold for hours only to kind of hit the end of the day and then the call doesn't go anywhere. So part of it is responsiveness, part of it is getting the applications and the paperwork processed. So that's starting to hit. So at the state level, the budgets are currently right there. But if the money starts disappearing, right, the cuts starting in 2025, January of 2025, that's what I'm reading at the moment. Who knows what it's really going to be? So that's when you're going to start seeing the dominoes, the trickle effects. So yes, I'm seeing some things starting, but it's higher up, like at the Social Security level, getting processing Medicaid. It's just gonna sort of be a great big toilet flush.
So, I mean, that helps us understand, in a really human way, how specific individuals with very different needs, not excessive needs, one would think, the need for some help around the house or the need for an adult daycare center, etc. We're not talking about enormous things, but when those things get pulled out, then it will be disastrous for many families who are already trying as hard as they can to support the family member with disabilities.
That's right.
Now, I want to go on while we have you for a different aspect of what's going to happen, which is we had a good Supreme Court ruling recently, AJT versus Osseo area schools, and a Supreme Court decision that upheld that students with disabilities can sue for discrimination and that they don't have to have a higher standard to do that, such as proving bad faith or gross misjudgment on the part of the school in order to do that. So this confirms the impact of discrimination in a school, not the intent. And on the face of it, it seems like a real win, right? That this was an important decision for as advocates of people with disabilities have said, because it's going to keep accessibility in K-12 schools. But it may not be as clear-cut as it seems. So let's start with the question of accessibility, which is mandated in the Americans with Disabilities Act, but not fully defined. So what exactly does accessibility mean in this case?
Right. So I think if it's okay, I'd like to step back just a little bit to define accessibility versus specialized instruction. So people aren't necessarily there are like two things that sort of pop up in schools. We talk about 504s and we talk about IEPs. So what are they first to define what they are, because it's easier to contrast or take a look at what's similar and how this impacts the student. So in 1973, Section 504 of the Rehabilitation Act, it prohibits discrimination on the basis of disability if the school's receiving federal funding, so it provides a free and public education. The IDEA is what addresses specialized education. We often call that the IEPs. So if a school is receiving specialized or receiving funding, both are mandated. 504 is equal access. The IEP is specialized instruction. So the 504, even though it's mandated, they provide service and accommodations to eligible students with a disability. It does not in any way address specialized learning, and that's important in a second. It is legally binding, but it's looser than an IEP. The coordinator of a 504, it could be a teacher, it could be an administrator, it could be a counselor. So it's not a specialized individual with specialized training inside the school. Teachers do not have discretion. They can't just say, yeah, no, not in this classroom. But it focuses on an accommodation. Accommodations are things like extended time for an exam or a test. Maybe it's preferred seating, assistive technology, or maybe a small group setting. But let's look at the IEP for a second, Individualized Education Program. So in the IDEA, there are 13 categories of disability. Um, and there is like other that helps create like a slightly larger catch basin, but it's more robust. It's updated regularly. IEPs are updated regularly in the schools. It's measured. It's goal driven. It requires expertise. We have special education teachers. We have a specialized case manager that oversees the process. So the 504, to me, has an interpretive quality to it. What does access mean? We know educators want students to learn. That's their business. That's what they do. But I find the definition sometimes clear, obvious, and sometimes muddy. And I'll use my son. I have permission to demonstrate this example. But we wanted him to have regular bathroom breaks when he was in grammar school and middle school, so that any incontinence issues would hopefully be avoided if he had a seizure. Now, does using the restroom, is that an accommodation, or were they just being nice to us to help avoid an embarrassing situation? What is an accommodation? What is an appropriate accommodation? Can be a little bit more subjective, right? So IEPs are qualitative. 504s are a little bit more, there's just more room to interpret what that really means. So there are budget constraints, there are educator availability constraints, right? We may see schools paying for a student in their district to attend a different school if it's more appropriate for that student's learning. Sometimes it's a private school, sometimes it's a specialty school. If they can't provide appropriate access themselves. So this could include tuition. This could include transportation costs. It can be very difficult sometimes to get the exact details because the agreements are often contractually signed and closed with an NDA. So I'm always still curious about funding, mandatory funding for 504s. There's a consortium of states. Consortium might be the wrong word, but there are a group of states suing the federal government, arguing that 504s being mandated is government overreach. And we know that disabilities come in so many different flavors. What's overreach? Why don't we look for better ways to provide an education environment for students? It's a big question. I don't have answers today, but even though the Supreme Court ruled that the person with a disability, the student with a disability, only needed to meet the bar of demonstrating impact, not bad intent, I still think that there's an awful lot of room for interpretation.
Right, and there's one thing that we haven't actually talked about here, which is the final question for the OSCEO decision is whether there will be anyone to administer and monitor accessibility issues because the Trump administration has attempted to close down the Department of Education, which until now has handled those issues. And in March, almost 50% of the department's employees were fired. So the firings have been challenged in court, but not yet resolved. So as we wrap up, let's run through the main points of what you've told us, Susan. And as you've explained, Medicaid is far more than a simple health insurance program, and it covers many small and large services that help people live more easily. In-home care to allow family members to work, help with daily tasks so that seniors can continue to live at home, transportation to appointments, out-of-hospital health services such as injections or dressings that allow people to stay out of the hospital. So how would you sum up the effects of the bill that the Senate just passed with its $1 trillion cut to Medicaid? What would be your final words?
I find it abnormally cruel to remove people's quality of life and their ability to live well. It affects our neighbors, it affects our families, it affects across states, whether they're the wealthy states that tend to put money into the federal programming, or whether it's the states that rely so heavily on Medicaid. I think people don't necessarily realize how important community it's human services. That's why it has the name human services. And they're providing people the ability to continue with their lives with dignity. It's a way of providing dignity and an ability for our friends, neighbors, and our families to live their lives to their best potential.
Yes, well, that's very simply and movingly put. This bill that just passed today is, through the Senate at least, is going to have waves and waves of impact, as you have shown us. So I want to thank you, Susan, for bringing your expertise and your own experience to help us understand what's at stake here. And thank you very much.
Oh, thank you, Sally.